Following the U.S. annexation of the Philippines in 1899, the United States began sponsoring select Filipino students to study at U.S. colleges and universities. The second wave of Filipino immigration began in the aftermath of World War II. Many more than 100 Filipinos arrived annually outside the quota, primarily as war brides to U.S. servicemen and as recruits into the U.S. Armed Forces, particularly the U.S. Navy. In addition, an increasing number of Filipinos arrived in the United States to train as nurses and other healthcare workers. Some of this increase is a direct result of the Immigration and Nationality Act's removal of the national origin system in 1965, but some is also related to long-established governmental and business relationships between the two countries, economic and educational opportunities in the United States, and a general culture of migration in the Philippines that encourages and helps facilitate both labor migration to and remittances from the United States and elsewhere. In the 2009 to 2013 period, the U.S. cities with the largest number of Filipino immigrants were the Greater Los Angeles, San Francisco, and New York. These three areas accounted for about 33% of Filipino immigrants. Filipinos, it has been said, are Malay in family, Spanish in love, Chinese in business, and American in ambition. Health and healthcare in the Philippines is viewed as a combination of folk traditions with Catholic religious concepts and Western allopathic medicine. Below are 7 cultural beliefs related to the acquisition of disease. In the Philippines, they define health as a state of balance, and they believe that illness is a disruption of balance or harmony. Holism and integration characterize beliefs and practices shared by Filipinos. Some things to consider when taking care of Filipino patients during labor and delivery include having a female caregiver available. Also, they will usually have a large family present at the hospital. A peltera or hilat may be present to help with the birth. And don't be surprised if your Filipino mother in labor wants to swallow a raw egg. This is believed to make it easier for the baby to move through the birth canal. But make sure to educate your patient on the risk of salmonella in the United States. Filipino patients may be hesitant to ambulate the first few days postpartum because they want to rest from childbirth. Also, in the Filipino culture, colostrum is usually not acceptable for the baby as it is thought to be dirty milk. A postpartum ritual bath is given anywhere from 15 to 40 days after giving birth, and taking a bath earlier is believed to cause headaches, eye and joint pain, alopecia, fatigue, and slowing or cessation of breast milk production. About 1/3 of Filipino children are malnourished. High blood or hypertension is widespread in children as young as 15 years old. And severe tooth decay is prevalent in young children and is linked to being underweight. As nurses, it is important for us to educate the parents on when to begin brushing their children's teeth, how often, and the importance of dental hygiene, as well as the importance of eating a well-balanced diet. Barriers to health-seeking behaviors include lack of personal resources, which includes time and social support, job-related issues such as being unable to get time off work due to long working hours, financial resources, and unemployment. Physical hindrances due to low motivation, being lazy, lack of self-discipline, illness, and disability. Language barriers like not being able to communicate what they feel and not understanding what healthcare providers are saying is also considered an obstacle to healthy behaviors. Filipinos also cited healthcare workers not having accurate knowledge in regards to their cultural beliefs, practices, and traditions. In the Philippines, it is a common cultural practice and support for mothers with young children to have a paid domestic partner, but it was reported that these were hard to find in new countries, which made it a challenge to take care of their health. Cultural gatherings are also very popular in the Philippines. They strengthen cultural identity and social networks in their new country. But during these celebrations, there are large amounts of sugary and fatty foods served that are popular. Some environmental factors that were barriers to healthy behaviors are the amount of readily available and easy accessible junk food and fast-paced lifestyle in their new country. Another barrier to health-seeking behaviors is not being familiar with the healthcare system. Not enough Filipino general practitioners and not enough information in their language tag along. These were particular barriers in recent immigrants and elders. Long wait times to see specialists, feeling rushed by their general practitioners, and conflicting work hours made it difficult to obtain care. Filipino Americans are at greater risk of diabetes, hypertension, dyslipidemia, abdominal obesity, and smoking across the lifespan. Healthcare providers may find it difficult to encourage health-seeking behaviors that will last and reduce risk factors that contribute to other diseases. Changing unhealthy behaviors is hard, but can lead to long-term benefits. Unfortunately, many times, clients are more concerned with the personal cost of changing, and as healthcare providers, it is important for us to be knowledgeable about what we can do to promote healthy behaviors, as well as knowing the barriers to seeking care of the Filipino population. There are many components listed that help this people group take care of their health. These involve having knowledge about good health, which can include eating healthy, exercising regularly, getting enough sleep, having good social support systems, and motivation to sustain health. Family is often indicated as a strong influence in self-care and maintaining healthy lifestyle choices, as well as being aware of chronic diseases and other family members. Traditional healing remedies that include massage and herbs, as well as a positive attitude, also were traits that help take care of one's health. Another component that encouraged healthy behaviors is the physical environment, such as having a clean environment, good climate, and less pollution is important, as well as access to parks and walking trails. Access to health services and knowledge of health resources are also important to this population. Many studies have investigated patient satisfaction, but this study focuses specifically on nursing care and how it affects Filipino elders. The sample of 300 Filipino geriatric patients were from the regions of Calabarzon and the National Capital Region. They were given cards with these 5 qualities: waiting response time, nursing uniform, empathetic capacity, meaning time spent in eye contact, and nursing skill. Then they were asked to score the cards on a scale of 1 to 12 based on most to least important characteristics. Surprisingly, the Filipino geriatric clients in this study overwhelmingly chose a nurse wearing a white uniform as the most valued trait, specifically a white uniform with a cap, which was seen as setting the nurse apart from the other healthcare team members. It seems that as they aged, they favored more conservative and traditional attire. The second most important aspect of care was empathetic capacity through time spent with the client. It has been shown that spending more time with a patient has been associated with greater patient satisfaction, reduced errors, and better patient outcomes. Wait time, which can be defined as a response to a call for assistance within 10 minutes, was chosen as the next important factor to the Filipino elders. Nurses' skill was second to last on the list of what this group considered to be important. It is hard to decide what a patient looks for when determining whether or not a nurse is skillful, but for the purpose of this study, skill is defined as the actual level of skill and experience of the staff. Finally, the least most important characteristic that these clients found important was empathetic capacity through eye contact. Sometimes eye contact can be intimidating to the patient. It is important to be receptive to patient preferences and help care whenever possible. This study can be a point of reference for current hospital and nursing care practices, particularly nursing skill and attire, as well as wait times. Filipinos have several native customs regarding death and dying. Atang is one of these traditions where a feast of the deceased person's favorite foods is prepared by the family in honor of their loved one, and a spot at the table is left open to remember that person. Another cultural tradition is burying the deceased with their personal belongings so that the person's soul won't have any reason to come back and get them. Also, it is culturally acceptable to keep the dead person's body in the home of the family during the grieving process. It begins with a novena, which came from Spanish influence in the Catholic religion. A novena is a Catholic prayer time where original prayers are recited and rosary beads are used. It typically lasts 9 days, and then the Atang feast takes place on the 9th day. As Filipinos have migrated to America and have had more American influences, some of their customs have changed. Organ donation was once unacceptable, but now it has become much more accepted. Also, novena prayer meetings in America have to be held in funeral homes because it is illegal for the family to keep a dead body in the home for the 9-day service. Family support and belief in God are important factors in relation to death and dying. Keeping family harmony is essential to Filipinos. Healthcare providers need to support not only the patient, but the family as a whole, which is very different from our own Western culture. Filipinos see caregiving as a responsibility and not a burden, so many times they prefer to go home to the Philippines to die, where there is more family support and financial resources. All these things need to be taken into account when caring for our Filipino patients. The Filipino healthcare system is mixed with both public and private entities. Filipinos generally use both as well as alternative forms of health models like folk healers or prayer. Here are some nursing considerations to think about when taking care of a Filipino patient. Filipino patients often prefer healthcare providers of the same gender. They also believe that health is maintained by moderation, hot and cold used to promote health, eating rice is necessary for a healthy life, and many foods used to promote health like garlic, ginger, guava shoots, coconut juice, bitter melon to prevent diabetes, and greens for anemia. Also, Filipinos generally don't seek care until disease is advanced, related to a belief to take illness stoically, as it will run a natural course or is a natural imbalance. In the Filipino culture, pain can be viewed as part of living an honorable life and process of spiritual purification. Also, they might have discomfort in sharing negative emotions, so many have somatic complaints or ritualistic behavior like praying. Keep in mind that mental illness carries a stigma and can be attributed to sorcery, soul loss, or spirit intrusion. Also, when working with Filipinos, it is important to provide holistic care. Multiple alternative forms of medicine, like folk healers in the treatment plan, herbs and religious paraphernalia, like blessed holy water, rosaries, and hilats, who can be thought of as a go-between person between Western medicine provider and patient, and provide prayers, art, skills, and a spiritual approach to support the Western care plan.